Hi, this is Dr. Robert Peltier. I'm Chief Medical Officer at North Oaks, and I'm here with my good friend, Justin Fowlkes. Dr. Justin Fowlkes is one of our pulmonary critical care physicians. He's board certified in both of those, and he specializes in respiratory care, and especially the lung. And why we're here today is really talk about navigational bronchoscopy. So it's a brand new service we're going to be having here at North Oaks. It's great that we get something here for our community. So Justin, start off, tell us a little bit about your background and your training.
I'm Louisiana born and trained. I went to medical school at LSU in New Orleans, and then moved on to internal medicine residency in Baton Rouge, and then back to New Orleans for fellowship, and landed somewhere in between, right here in Hammond at North Oaks.
And this new procedure that we're doing, navigational bronchoscopy, tell us in basic words, what is that? How does it benefit our public? And tell us what it is.
Traditional bronchoscopy is done with a scope, a flexible scope, and a camera and a light, and mainly our hands to guide the procedure and guide the scope. The new therapy that we're offering, navigational bronchoscopy, is actually robotic bronchoscopy with navigation. So it allows for a much greater level of precision because there's a robot that I'm in control of. And then the navigation component actually allows a CT image, a CAT scan image of the lungs to be loaded into the software of that robot to allow us to drive right up to the abnormality in question, and to precisely locate that using some additional tools in the procedure itself, and really opens up a whole new world in the terms of minimally invasive biopsy.
How does a patient get to you for this?
I'd say far and away the most common presentation is an abnormal imaging study, and whether that be on a CT lung cancer screening in a patient with a history of smoking, or whether that be in a patient who was having symptoms, maybe a cough or some shortness of breath and got a CT scan, or even a patient that got a CT scan for a completely different reason and just had an incidental abnormality discovered. But I'd say far and away that's the most common reason patients come into me.
Well, we do know that the number one reason for lung nodules and lung cancer, the biggest risk factor, is smoking. Talk a little bit about smoking cessation. I know there's somewhere here on campus that you send some of your patients to help with that, which it's really difficult to do.
Yeah, absolutely, Rob. It's a huge asset to our community, as well as the physicians here within North Oaks. You're talking about the tobacco cessation clinic. We send tons of patients there, and what we have there in that clinic specifically are a network of providers that are there to help patients quit smoking. And we know that it's a very difficult thing to do, stop smoking. Tobacco and nicotine specifically is one of the most addictive substances on the planet. And no one medicine or no one tactic is best for any patient. And we know that the combination of help from a clinician as well as medication are really the best ways to get patient off of nicotine, off of tobacco, and to stay off of that successfully. And in order to help patients with that, we send them frequently to that clinic. It's very easy for me to sit there in 5 minutes in the clinic and yell at somebody for smoking, but I think it takes it a step further when I say, hey, look, I think you need to quit. We've got this program. Let's get you into this, and let's get you on the right track.
And you don't have to have a lung nodule or lung cancer to be eligible for the tobacco cessation clinic. You can call 230-2778 and schedule an appointment. If you're just a smoker and want to quit, please come to that clinic. It'll do your health really good.
Absolutely.
What else could you tell us about this procedure that you wanted to make sure that the public knew?
We have it here at our institution, and although it's relatively new offering at our institution, it's not a new technology. This is not something that just came off the market and isn't well vetted. Lots of studies out there, and I've been performing these procedures for a while here, and we also have a new physician recently hired, but again, although she's recently hired, she's not new to this procedure. She has done many of these procedures as well, and so we're going to have two doctors right here at home that can take care of our patients and not have to refer them to outside facilities or to other physicians within our own institution.
Well, we want to thank Dr. Fowlkes for giving us time to come talk to us today about navigational bronchoscopy. There's a whole lot of information on our website at northoaks.org. Again, thank you, Dr. Fowlkes, for spending your time talking about navigational bronchoscopy.
Yeah, man, happy to be here, happy to get the word out. And like I said, we are really excited as a pulmonology team to be able to offer this service to our patients in the community and keep them right here at home.